Let's talk about a case of manipulation by a clinical psychologist. A case that, when I heard it, left me speechless. One day I was calmly scrolling through TikTok and suddenly this popped up.
Storytime about how my psychologist allegedly told me that I was crazy and tried to convince me through humiliation to get me to come back to her office.
As you know, we often analyze cases of terrible, awful psychologists here. And so, I take the opportunity to explain what things are normal and what things are not normal in a session. And I share this with complete transparency, knowing that some things will be easily understood, like when I reacted to horrible psychologists doing horrible things. While there are other issues and practices that might be a bit shocking. For example, when I explained why the psychiatrist in the famous case of Kendra didn't refer her, even though he noticed that she had developed erotomania. That is, a delusion of believing that an inaccessible person, like the psychiatrist, is in love with her and that they are having a secret relationship. And the profession of a psychologist is delicate, it's complex. It's not enough to study psychology and then psychotherapy, you also have to train in ethics and legal matters. You must learn to work practically with patients, do your own analysis and therapy, and attend supervision sessions. You have to know how to manage the relationship between psychologist and patient very well. You have to be able to detect what's happening there in a subtle way. Choose each of our words and actions with great precision and caution. Not only because of the rules or the code of ethics or the consequences, but because what is co-constructed between the psychologist and the patient and their relationship has a huge influence on the outcome of the therapy. A bad response, even unintentionally, can trigger that wound and that fear of criticism that the patient may have, and then they might see you as their enemy. A story that's misinterpreted can end up reinforcing the patient's victim mentality. Or an attitude that's too rational and analytical can invalidate the patient's emotional needs at a time when they just want to feel understood and validated. It's not just the tools we give, but how we give them. It's like a waltz. A carefully measured choreography you must dance with balance and care, or it gets cut off. Psychologists who, instead of a waltz, come in and start breakdancing and doing really weird things that end up feeding into the bad image that many people might have about psychologists. And the thing is, there are always people in the comments of my videos criticizing the profession with a peculiar tone, as if assuming that I'm the representative or spokesperson for all the psychologists in the world, and assuming that I'm going to defend everyone no matter what, and claim that they're all amazing and wonderful. For example, in the video where I analyzed the tarot reader's manipulation techniques, her actions made no sense. Many comments challenged me, claiming there are also bad psychologists, and I'm like, yes. Someday, if you want, I can make a video talking about the bad experiences I've had with psychologists, because I've had both good and bad experiences. But well, at least, even though some of them were a bit terrible, they definitely weren't going to hurt me, nor did they overstep their boundaries, and much less try to manipulate me. Like in the case we're going to see in this video, so let's get to it.
And yes, I said allegedly because she never admitted it, she never said it was her, but I have it recorded. I'll show you all the evidence so you can draw your own conclusions, as I did.
Well, admitting what's coming next, careful. I assure you this is the first time I've ever heard a story like this about a psychologist. Just like this girl makes the legal disclaimer of allegedly, I'm going to do it too. I don't know this psychologist. I don't know who she is. I can't say that the story is true. So everything I'm going to analyze and everything I'm going to say is about the story that this girl shares on social media. So all of this is allegedly?
Let's go back to September 2024 when I switched from seeing a private psychologist to a Sanitas psychologist.
Okay, we see that this is a psychologist she got through her insurance. I've never worked with insurance companies and honestly I wouldn't like to, because what insurance does is cover the patient. A few sessions, usually around 10, 12 or 15, and then the therapy ends. Bye, see you later, my Carmen. As you know, I work from a very deep, analytical, emotional and very human approach. So, having a framework of X sessions, and on top of that it's just a few, well, not only does it give me very little time to do anything, it doesn't give me time to work the way I work. And there's always that pressure and that stress of, You have to have results right away, even if they're superficial results that will fade as soon as the person leaves the session. If we're talking about a very cognitive behavioral intervention, or maybe brief therapy, strategic therapy, approaches that are very focused on a symptom, on a specific problem, well, this concept of a brief number of sessions makes sense, but as I said, it's not the kind of work I like. Pulling out a weed if I know that root is just going to come up somewhere else as another weed. But anyway, let's continue.
I had to go every week, on Fridays, and that already seemed like a lot to me, and I told her that several times. I only have 15 sessions because when those 15 are over, then you have to pay a high price.
Of course, as I said, having that limited number of sessions creates a feeling of stress and anxiety in the patient. Always afraid of wasting time or not making progress. What will happen when the sessions end? And the psychologist can also feel that anxiety or that pressure to speed things up. Therapy has its own timing. There are things that, for example, I can't say in session 3, but a series of things have to happen with the patient before I can say them. And well, you can be in a hurry. Can knowing them actually sabotage the therapy?
The sessions lasted 20 minutes, and besides, the only thing she asked me was how my week had been, how I had slept, and not much else.
Wow, if we talked about the number of sessions, the duration, it was 20 minutes each time. There's not enough time to do therapy. There's only enough time to monitor how the symptoms are going, how the results of another intervention are going. There's time to assign tasks, exercises, to provide some tool or resource. But when it comes to actual psychotherapy, 20 minutes isn't enough. And this is where the importance of the framework lies. It's very important that at the beginning of therapy, the psychologist explains things to you and makes sure that you understand and agree. That they explain to you how they work, how the sessions function, what rules apply to both of you, what you can expect and what you can't. And both of you agree on some goals. You make an agreement. So, if your psychologist explains to you, look, my work is totally focused on the symptom. We're not here to talk. We're not here to chat or go deep. We're here to focus on what's bothering you. And that's why the sessions are brief and very focused. Great, you get what you're going for. And as I said, depending on the type of therapy, the therapist, the context, this is fine. Again, as a person and as a psychologist, I don't like to work this way. And I also don't like it at all as a patient. But for example, in a follow-up context, a checkup, public health care, well, that's normal.
I ran out of sessions and the psychologist told me, since your mother also has a policy, she also has 15 sessions, let's use your mother's sessions. Be careful with this, since it may come up later. She also told me to keep it secret because it's not allowed.
Well, this is a bit delicate, debatable. Is she inviting the patient to misuse the insurance? I'm not a lawyer. I don't know if this could be labeled as fraud or something like that. As a psychologist, I can understand that desire to try to provide your patient with the help she needs at all costs. It creates a lot of frustration to want to help someone and know that they can't afford it. You're also putting the patient in a tough spot, encouraging her to do something that's borderline. I don't know if it's fraud, I don't know, but of course, a therapy that's done under an illegal or gray area framework, possible problems, well, it already taints the process with stress, discomfort, pressure, ugly things. I don't know. What do you think about this? I'll read your comments. Many psychologists at some point have felt the temptation to help too much. But of course, making a mistake is one thing and manipulating is another, like what we're about to see next. You'll see.
I got to a point where I said, I'm tired of coming here. It's an hour each way for only 20 minutes, and it's not worth it or helping me. I don't want to come anymore.
Totally understandable. And from what you said, I understand, maybe I'm wrong, that maybe that framework hadn't been established. Because it seems like she was disappointed with the therapy she was receiving, the brevity, the superficiality. If they explain up front how the sessions will be, you might quickly decide not to continue. But it's very different to be waiting for the moment when things will get deeper, when you'll work on something more emotional, more profound, more human.
I said when summer ends, since she scheduled my appointments, that's it. Simple as that. It's like the whole thing gets a bit forgotten until she writes to me in September 2025 and says, Hi Anna, I hope you had a good vacation. I've scheduled appointments for you for the whole month of September.
I'm not sure if they discussed seeing each other after the holidays, had closure, or left things unresolved. But generally, before assuming that your patient is going to return to therapy and unilaterally scheduling a few sessions, what you do is reach out to them to see how they're doing, how they're feeling. if they want to resume therapy, if they want to do it later, or if they want to end it, and in that case, have a closing session. It's common that if at some point you decide to leave therapy, they'll say, that's fine, but let's have a closing session first because it's important to share how you've been feeling, how the goals have progressed, what the reasons are, so you see that their doors are open in the future. What to do if you relapse or start feeling bad again, and similar situations. It's not done to scam you or because they want to keep you or recruit you again, but because a process has to be opened and it has to be closed. It's something that psychologists have to do, but we can't put a gun to your head to force you either. If you don't want to, that's your right.
I told her, no, cancel it because I didn't make the appointments. My mother called because in the end she's the one who pays, and she canceled all the appointments. The psychologist messaged me saying, I saw you canceled the appointments, what happened? I replied, I'm not going to come to the sessions anymore.
In any case, it's a bit coercive to unilaterally and without prior notice schedule all your patients' sessions for a whole month. Even more so, knowing her mother's insurance sessions are almost used up. But here's the most shocking part. Pay attention.
Here comes the drama. I get a message from an Instagram account that says, hi, up to this point everything's fine, nothing unusual. I say, oh, okay, thanks for checking it out, and they say, you're welcome, haha. You go to the psychologist just for asking, and they call me wow.
The psychologist tried to manipulate, but she doesn't seem very skilled at it, does she? If you've read my book, It's Manipulation and you don't know it, you'll remember that one of the 3 basic rules for good manipulation is to go little by little, gradually. And here, the intentions were clearly seen. And also, on the same day or the day after, she decided to cancel the sessions. So, obviously, the girl realized it quickly. It's very obvious. If he had started a conversation, if he had talked for a few days about other topics, if he had led the girl to bring up the topic of therapy herself, then maybe he would have had a chance. But this is a bit clumsy. By the way, just a little while ago I received the Dutch edition of my book. It's now available in all bookstores in Belgium and the Netherlands, and also on Amazon. So if anyone wants to practice this language, well, there you go.
I told him I used to see a psychiatrist and previously a psychologist, but I stopped. He asked why, and I said it was too expensive and didn't help much. To which she replies, well, in your videos it seems like you need a psychologist, maybe you should go to Sanitas Psychology, it's not expensive, I used to go through insurance.
Oh my gosh, I'm feeling a bit embarrassed that a psychologist would do this. I don't know, I don't understand. At what point do you think something like this is going to work? That the breach of ethics, morals, and rules is just obvious? But just thinking in your head that this is spectacular, that it's going to work, isn't that a total breach of ethics? Writing to your patient from a fake account is also very sinister. And on top of that, attacking their privacy, their vulnerability. What's going on? What does a psychologist say to them? It's really ugly, it's very intrusive.
She starts telling me this. I had my mother next to me, and of course my mother started saying, wow, this seems really strange. So I say to her, yeah, but I've already unenrolled, why? And she replies, why, who was it? And I tell her, a girl who has the same name as me. And I say, because it's far away, and besides, I ran out of sessions. And she says to me, listen to this, she says, I use my parents' sessions so they don't charge me.
What a coincidence. It's just what the psychologist suggested.
Anna sounds familiar to me because yes, my psychologist was named Anna. A friend of mine goes to her and says she's super happy that Anna has helped her a lot. And I start asking her questions and I say, I don't understand you. And she tells me, a friend. She went with a girl named Anna Joven and she was very happy with her, and to this day she's still with her.
It's wild. She even recommends herself. Oh my god. Later, I'm going to talk about what might be behind this behavior and this profile on a psychological level.
And I ask, why are you saying this? Do I need a psychologist? Isn't it strange for someone to direct message you on Instagram and say that? She replies, I saw your video and thought you needed mental help.
Also notice how extremely invasive this is, saying that you can tell someone is mentally unwell just by watching their videos. I don't know about you, but I think it's significant when someone says you seem unwell just from your videos or social media. Psychologically, it can make you feel very exposed, create insecurity, doubts, and make you feel watched. Fortunately, this girl caught on right away. Who's behind it and with what intentions? But for a psychologist to tell her patient from a fake account that in her videos it's clear she needs mental help sounds a bit perverse, a little dark, setting aside rules, ethics, and empathy. It's a bit questionable because something like that can really affect a person, even more so if you, as a psychologist, know that person has psychological issues.
and I told her, I think you're mistaken because I upload videos of abandoned places. I mean, that's the truth. I focus on uploading videos of abandoned places. She told me, that's why I thought you weren't okay. That threw me off, and I replied, I'm perfectly fine. Many people make that content, and there's a reason I have so many followers. This all just seems strange to me.
Thankfully, the psychologist won't judge you.
And he says to me, is it strange? I tell him this conversation seems strange to me. Are you involved with the psychologist? He also asked if my YouTube channel is strange.
With all this, I wonder, how did the psychologist find his channel, his social media, his account? There must have been a process of investigating, searching, stalking. That's what's really scary, not the videos. I have some colleagues who I know follow their patients or some of them on social media, although they first ask for their permission and explain the reason. Honestly, I don't really agree. If you were already following the person because you know them and they reached out, that's fine. I understand it better, but I find it a bit invasive. Your psychologist should only know what you share in the session, nothing more. It doesn't feel very comfortable to open your stories and see that your psychologist has viewed them. I think it can influence your behavior in how you present yourself in therapy afterwards. I think it can contaminate things. And also for me as a psychologist and from the model I work under, I'm actually more interested how the patient communicates to me, what has happened to them, how they feel about themselves, how they perceive things. I'm interested in working with their subjectivity. Being on social media and seeing their daily lives, will that interfere? Anyway, what do you think? Let me know in the comments. And how would you feel if your psychologist followed you on social media?
And when I tell him it has something to do with the psychologist, he clearly tells me you have a problem. I have a friend named Marcos who has borderline personality disorder who also uploads videos of abandoned houses and needs both psychological and psychiatric help.
What a good argument.
I told you because you reminded me of my friend when I asked you. Look, I was the one who told her about the friend. She got things mixed up because I told her about an issue with someone with borderline personality disorder, and I also have another friend named Marcos.
Okay, so besides using a fake account, stalking him, watching his videos, deceiving him, writing to him, trying to manipulate him, on top of all that, she's trying to use his personal information. Things they've talked about in the sessions, things he's shared with her, names of friends. These kinds of sensitive, personal, confidential matters happen in session, and that's where they should stay. No matter how much you want your patient to keep receiving your help, you can't use what they've shared with you in session. For persuasive or manipulative purposes,
I'm going to tell you what happened next. Basically, my brother gave her his phone number to talk to her. First, the girl told him she was a teenage girl who went to high school. Then she changed, and suddenly she was an older girl who went to college. So my brother says to her, let's do something. Prove to me that you're a real person. Take a picture of yourself raising your arm. A picture of your face with your arm raised, in the position I'm going to tell you.
Besides being unprofessional, what strikes me is that there's very little planning. I don't know if it's low awareness, poor planning, not taking things into account, not thinking about the consequences, or just poor impulse control. It's a somewhat disorganized or impulsive behavior. It's not typical of a professional. He seems to be improvising, acting impulsively, making mistakes, and jumping from one thing to the next. A figure of clumsy thieves, of changing moods.
She blocked my brother, and do you know what she did? She deleted the entire Instagram conversation. As you can see, only my messages are there, and not only did she delete the messages, she deactivated the account.
Anyway, let's pause the story for a moment to analyze what could be behind this person's actions, psychologically speaking. And then we'll continue with how the girl handled this situation and what we should do in these cases. Of course, the financial factor can play a big role here. In the end, a psychologist works by helping people, but they charge for it. And logically, losing a patient, if you don't have a lot of demand as a professional, means losing income. You have to keep in mind that the economic factor, when it comes to caring about losing a patient, loses a lot of importance. As you become a well-known professional with high demand, aren't you worried about those gaps in your schedule? Just to be clear, I'm not saying that a psychologist with low demand is going to trick you to get your money, not at all. But what I'm trying to say is that behind cases where psychologists try to prevent their patients from leaving, there are often other reasons, beyond just financial ones. And also, I believe that these reasons are more relevant to most psychologists' behavior than the financial factor. Let me explain. As you can imagine, in my life, I've been in contact with many psychologists, future psychologists, and psychology students. And I can assure you that I don't know a single psychologist who has prioritized the financial factor over other things, nor have I met any psychologist who got into this profession to get rich. In fact, quite the opposite. The majority were guilty of thinking too much about others and too little about themselves. About their finances, about their needs. When we train psychologists, for example, we don't have to worry about them taking money from their patients, because that's not what usually happens. What actually happens is the tendency to give too much. Usually, people who come to this profession have a strong calling and an altruistic personality. Of course, there are always exceptions, but honestly, I'm telling you, the norm among psychologists is to think of others before themselves, and they definitely don't get into this profession for the money. However, there are other factors that sometimes lead psychologists to make mistakes or act wrongly when they want to prevent a patient from leaving. And they have more to do with emotional issues, matters of identity, things about themselves that they haven't resolved. Let me tell you. Psychologists tend to build a lot of their identity around their profession. Since it's such a vocational thing, something that comes from deep within, and since it's a role that, in the end, affects all areas of their life, not just the professional one. Well, there's a lot of ourselves invested in how well we do things, in whether we manage to help the patient. And to this part of identity, self-concept and self-esteem, there's also a very deep fear of failing, of not being able to help others. I assure you honestly that when we start working, we're not thinking about how much we're going to earn. We're thinking about whether we'll be able to help whoever comes to us. We start out with a lot of fear and a lot of insecurity. We tend to be very self-demanding people, and there's also quite a bit of a savior complex. But be careful, it's not as perfect as you may think. Claudia Nicolasa, are you saying I see psychologists like angels? It's not like that. Ego plays a big role. So when a patient drops out of therapy or tells you it's not working for them or that they want to leave, it really affects your ego. A therapist who hasn't worked on themselves personally or who has this wound of self-concept, of ego, usually experiences the patient's discharge or decision to leave as a narcissistic rejection. And of course, keeping the patient at all costs is a way to protect that self-image. Because they are not able to tolerate a patient saying that the therapy isn't working for them, whether that's true or not. Also, in some cases, what happens is a fear of abandonment. Just as the patient may have a fear of abandonment, a psychologist can have it too. And well, in the end, when these wounds are not properly worked through, they can lead the psychologist to have controlling behaviors, to pressure, to force. Psychologists. We are human. We are not perfect. Each of us carries our own emotional baggage, flaws, wounds, and experiences. And that's why I believe it's essential for psychologists to have their own therapy, to do their own analysis. You should know that this is not mandatory to give therapy, and I think it should be. Having gone through a therapeutic process at least once. Otherwise, your own issues can easily interfere with your work. For example, I confess that on some occasions I have made bad decisions because I came to my practice with a case that touched on my personal history of having witnessed abuse at home, or because I was very inexperienced. And letting the desire to help, to save, make me get too involved and cross some boundaries that are there for a reason. But whether it was for money, or because of personal wounds, or out of fear of being a bad psychologist, nothing justifies these actions. So let's see what this girl did. The next morning,
obviously, I called the center and told them everything. Because it's not the same when a stranger comes and insults you or says something stupid as when it's someone you know and supposedly is a mental health professional. My mother and I called the health center to report what happened. Do you know what the receptionist's response was? She told me, "In all the years I've been working here, nothing this serious has ever happened to me. I've never seen anything like this." And it's true, because after all, it's not a trivial matter. If it had happened to someone else, something much worse could have happened.
Exactly. You're working with people's vulnerability, and something like this can cause a lot of damage, especially if it's someone in a fragile or unstable situation.
The receptionist said she would pass this information on to her superior and that they would take action. One thing my mother said, well, she's a mental health professional. Supposedly, the people who go to her are people who have problems and need help. And of course, you can't go there and use your patient's information to say that they're crazy. And if she's a professional and you can't even trust her, who are you going to trust if even the professional does this to you?
Imagine if this were a patient with a betrayal wound, with a lot of trust issues, afraid to open up, or with a paranoid profile. the psychologist would actually be reinforcing and worsening her condition, her problem, which is really harsh.
Many of you have commented that I should report it to the board of, well, I'm not exactly sure what you said, maybe the board of psychologists or something like that. I didn't know that was something you could do, honestly. Of course, I have that conversation recorded, but what if she doesn't admit it's her? Would there have to be an investigation to find out whose account that is?
Yes, I should report this to the official College of Psychologists, the official College of Psychologists. I believe several articles in the Code of Ethics are being violated here. Article 11. Do not take advantage of your position of power for personal gain. Article 44. Do not use information acquired professionally for your own benefit or to the detriment of the client. Article 40. All information is subject to the duty and right of professional confidentiality. Each country has its own code, so if you're from outside Spain, you should check your country's code.
That was my principal. The psychiatrist was a bit like, "Are you serious?" When I showed the conversation to the psychiatrist, he was shocked. He said, of course, with what you're showing me, it really looks 99% like it's her. The truth is, I have to tell you that you did pretty well, and thank goodness I recorded it because I've had a history of psychotic episodes. Maybe they think that I'm either delusional or who knows what.
Yes, I have to agree with both of them, with her and with the psychiatrist. She did very well, she handled it very well. And if, unfortunately, the person has a history of severe mental disorders and psychotic problems, and if, in addition, which I don't think is the case, has she had similar problems with other professionals before, her testimony can, I repeat, can be heard differently than that of another patient. In situations like this, it's important to document and seek help from third parties, such as the brother or mother. The psychiatrist is a good protective strategy because they provide that shared reality from several witnesses. There is evidence, and it greatly reduces the possibility that they can gaslight you, like, you haven't seen anything. Right? Unfortunately, regardless of who reports malpractice among psychologists, it's very hard to prove. Because, well, in this case, the psychologist was extremely clumsy. I don't understand anything, but she left evidence, and the girl was very sharp to record the conversation. But most cases of malpractice happen in the office between the patient and the psychologist. There are no witnesses. No one is there, no recordings, no messages. It happens when you're alone with the psychologist. It's up to you to report, but if this happens to you, you should report it. Because if that professional does it with other patients, even if there is no evidence, in the end, if they receive multiple reports, then things can change. That's how, for example, psychologists who sexually abuse their patients have been caught. Anyway, I hope you liked the video, that you were as amazed as I was with this case, and tell me if you want me to react to these kinds of bizarre and sinister situations involving psychologists. And to finish, on a slightly sweeter note, let me tell you that there are excellent psychologists, there are really good professionals. Sometimes it's hard to find one who is good, who you also connect with, and who also happens to do the type of therapy you need. But I truly mean it when I say that most people who get into this field do it out of vocation, because they are passionate about psychology, because they want to help others. And well, I hope these videos help you recognize when a psychologist might be acting appropriately, when they might be acting inappropriately, and when some boundaries might be getting blurred. So that's it, a hug, and I'll see you in the next video. Bye.